Hi, I'm Dr. Kimberly Turner, and welcome to Moms, Minds, and Medicine Inside Maternal Health Research. This podcast is your trusted companion on the pregnancy journey, where we break down the latest insights, answer the real questions, and empower you to make informed decisions every step of the way. Hello, and welcome to Moms, Minds, and Medicine Inside Maternal Health Research. We're on episode 4 of our podcast, and we're so excited to have two guests today, Dr. Nia Leak and Ms. Pamela Osseyi, to discuss the role of the patient advocate, and in particular, the role of the doula to support women through their reproductive journey. So, good morning, ladies.
Good morning.
And thank you again so much for your patience and time and willingness to share your expertise in this area. So let's just start with Dr. Lee. Can you tell us a little bit about what led you to this point in your career and maybe a little background about your career?
Absolutely. So I have been an OB-GYN, hate to say it, but love to say it, for over 20 years now.
Yeah.
And I chose this career path really because my family is dominated by women. I've been fortunate to be surrounded by close friends and sorority members and church members that really have been female dominated and have really played a role in my life. And so I always knew I wanted to do something for advocacy for women. I also wanted to be a doctor. And so it led me to being an OBGYN. I am actually practicing in my hometown of Columbia, Maryland.
Yay. Yay, Columbia.
Yay, Columbia. And it really is just an honor to be able to be a resource to the people I grew up with, the people in my community, my family, my friends. And that really is what led me to becoming an OBGYN.
Great. And what are you seeing a little bit, just background about doula work? How did you get onto this particular subject of interest?
I started with advocacy. And to me, doulas are advocates. They're advocates for the patient. They're advocates for the natural process of labor. And so I want the best for my patients. I want my patients to have, a sense of security, a sense of comfort, and really be able to build those trust and bonds with the healthcare system. And doulas are part of that. And so it's just natural that I also want to support them as they also look to support our women.
Excellent. And what she didn't say is that she's at Johns Hopkins University Johns Hopkins Medicine in Howard County.
Correct. Exactly. And I've been here for about 10 years. And so, it's great to be leading the way as far as research, recognition, and name. But again, it's important for us to be able to, make a difference in individual lives. And that's my goal and role.
Excellent. Thank you. And Miss Osei, so the audience doesn't know, but I know that you are a doula, that you've been trained, that part of your education was at Morgan State University. So just give us a little bit about your background and what led you to be interested in this area of medicine.
Yeah, so as you said, I am a proud graduate of Morgan State. Graduated in 2023 with a bachelor's in psych and a minor in criminal justice. I am a mental health substance use researcher. I'm currently at Hopkins right now. I'm going for my master's of health sciences in mental health. But what led me to this work was basically my own birthing experience. I was fairly young when I had my son, and I remember feeling like I lacked knowledge or confidence to advocate for myself. I was like kind of strong armed into going through an early induction for my son. And I remember it was because they kept telling me, like they thought he was too small and that my placenta wasn't working. And, we ended up having the baby, and the first thing the doctor told me when the placenta came out was like, it's working fine. You're probably small. You just make small babies. But like throughout my pregnancy, that was never something that you told me. You had me feeling like I'm failing my son. My body is failing.
Oh.
So that experience always stuck with me. I've always been drawn, similar to Dr. Leak, I've always been drawn to spaces where people needed advocacy and care. So that allows me to provide that advocacy and care that I felt like I needed at that time. It allows me to bring compassion and education into those moments where people deserve to feel empowered and not overlooked So yeah, that's
Okay. Well,
long
thank you for I appreciate you sharing your personal journey and what led you here. Can you explain exactly what a doula is for us?
A doula is someone who provides emotional, physical, and informational support throughout pregnancy, the birth, the postpartum stages. We don't do anything medical. We don't take place of OBGYNs or PCPs. We don't do exams, procedures. We're just there to make sure the birthing parents feel supported, informed, and seen. I remember like going through my doula training, we were told that like doula work is about mothering the mother. We're just there to offer that care, reassurance, and grounding presence throughout these stages of pregnancy.
That's beautiful. So, Dr. Lee, can you talk about a time when the doula made a difference from your perspective, from the patient's perspective? Maybe just give us a little vignette.
Actually, I could probably give you quite a few vignettes because doulas make a difference in my world all the time. But one specific one I do remember, I'm really an advocate for trying to reduce the rate of cesarean sections. And it's become so common that sometimes people want them.
Yes.
Once labor starts and reality kicks in, sometimes people want to give up and say, you can get my baby out via C-section in 20 minutes. Let's go that route. So we had a patient who was going through a rather long induction process. And I think just fatigue started to set in and just that desire to just be done and go ahead, do my cesarean section. And she had a wonderful doula who had followed her during the course of pregnancy, was there during the induction process, who really was an advocate for her. So when she really got to the point of frustration, I felt my role as the physician was an exit strategy. And so for me to advocate for continuing to go, come on, we can do it, we can make it. It really was kind of like, doctor, I'm telling you now, I'm ready for a cesarean section. And so that's really when the doula came in, just to really kind of work with her, do some breathing exercises, try to encourage her to find the strength within. The baby was doing fine. The mother was actually, healthy at that point. We really did not have an indication for a cesarean section. And so the doula really was just, let's just give it 30 more minutes. I'm here with you. Let's try to figure it out. And with the doula, the patient began to relax, which is a vital part of progression in labor. Really encouraged her to kind of move in the bed a little bit to allow our bodies to start to do the work. So when I went back in the room, the patient was like, okay, you can give me a little bit more time, but be ready. And so thanks to the doula, she really talked her through the rest of the remaining process just to keep her calm and just allow the process to happen. And she ended up delivering a beautiful vaginal birth without any problems or complications. And at the end, it was kind of like, well, thank God for my doula who got me through. And I was like, well, I didn't want to cut you either. So, that's one of the challenges as the physician, but one of the benefits of multiple benefits of a doula being a patient advocate and really mothering a mother through the whole process. And so I will always remember that story. She was done. She was ready. And I was like, Doula, you need to work on. Come on,
Yes.
come on.
Sometimes labor is such a long process. And I recall those moments too in clinical medicine where you're just tired. And I think that's why the doula has become a ever present role, because even your own family members at some point can't help you advocate, or your partner or whoever is your support person, because they're also fatigued and have not been through this process. So, Miss Osei, I know that doulas can have a role before pregnancy, when planning a pregnancy, postpartum. Can you
Mhm.
give us your perspective on all of the things, as you said, non-clinical, that the doula can do and support the family?
Yeah. Doula work doesn't just start or stop at the birth cycle. It can also look like helping someone navigate like fertility options, or just being a safe space to talk about doctors, being a safe space to talk about their options, emotions, and fears. It can also just look like being a supportive person, going to with them to like pre pregnancy consultations or
Mhm.
appointments. What I like to do when I'm working with somebody, I like to basically ask them what it is they're looking for and like just find the best way to create that experience, because it's very vast depending on who you're dealing with. So that was in terms of the pre-pregnancy.
Mhm.
In terms, should I also go on to what doula work
Sure.
like in that birthing space?
Please do. Yes.
Okay. So, like I said, it's about emotional, physical, and informational support. So, as far as emotional support, it could just look like, in that space, I'm giving you affirmations. I'm reminding you that you are strong. You could do anything. You had a plan. You set your mind out to it. Let's see it through. It can also look like, maybe you're feeling flustered and your anxiety ridden mother in law is in the room. I'm sending her on a
Mm.
fake and I'm getting her up out of there for a little bit. Um, Informational as well. Like I said, making sure we are communicating with doctors as well. You're informed of your options. Like Dr. Leak said, the doula is not an opposite role. We should be strategically complementing each other. And at the end of the day, being that we're not medical providers, it's ultimately to we do defer it to the doctor, but I would try to make sure that everybody is well informed of every option before we go on. And physical, it can look like me just giving you massages in that space. Everybody's not a big fan of touch, so maybe I'm teaching your
Mhm.
partner or someone that you are more comfortable with how to go about certain strategic massages or places, or just basically how to touch you in that moment. So
Right.
like I said, it's definitely based off that individual person, but I talk a lot in general. So I like to really pick people's brains when I'm working with them to just figure out what they want to create that ideal supportive environment for them. I think doula work is like, we have a plan. It may not always go that way, but if I
Sure.
think my role is to best support the experience that you had for you, like your ideal experience, because it's already a stressful time. And I just, want to make sure every woman gets the most out of it, the most positive experience out of it.
Great. Thank you. So, how much does it cost? And does insurance cover this, Miss Osei?
So insurances are starting to pay for dual work depending on like your insurance, your residence area as well. There are also community-based programs in hospitals that might offer like free or low cost doula services for families who might not otherwise have access. Some people do pay out of pocket if they can afford it. As a doula, I offer a sliding scale because I feel like doula care needs to be more accessible, especially for the people who could
Sure.
truly benefit for this.
Okay, great. So, can we talk a little bit about how to collaborate? There's a lot of people now involved in this
Yeah.
prenatal, preconceptual space. So, particularly, I was thinking how in the labor room, especially where I used to work with Dr. Leak at
Yeah.
Howard County, only a certain amount of people can be in the room at one time. So, how is the collaboration looking? And is it easy to get an extra person there to advocate? Dr. Leak, what's happening now? I'm not there anymore.
Yes. So most hospitals, which include all of the hospitals I'm affiliated with, doulas are not considered family. They're a necessary team member. And so they're allowed in all the same spaces, no matter, it's separate from the number associated with family. And so again, that is us honoring the, respect that we have for the role of the doula. And so if you want to bring your doula, bring them.
Oh, that's good to know. I did not realize that.
Yeah.
Okay. Any last minute thoughts that either of you have? I think I've covered everything I wanted to get out. Or what's one takeaway for the audience?
One takeaway. Um, that nobody should have to go through birth alone or uninformed. Everybody deserves to have someone in their corner that sees them, who listens to them, and helps them feel empowered in their choices. Birth is such a vulnerable and powerful experience. And one quote that always stuck out with me was, "I'm only as strong as the women next to me." And I feel like that's what being a
I
doula
love that.
is about, like standing beside people in their most powerful, most human moments and helping them see that strength in themselves.
That's beautiful. Dr. Leak, any last? And actually, before we get Dr. Leak's perspective, we have not talked about the doula support in the postpartum period and with the breastfeeding. Give
Mhm.
us a little bit about what that looks like, and then I'll get Dr. Leak's last minute
Yeah,
takeaways.
so in terms of doula support postpartum, once again, it would depend on like what your individual client needs, but during that role, it can be like checking in about like how they're feeling, how they're sleeping, how they're feeding, how's their mental health, reminding them it's okay to ask for help. Once again, doula work is about being consistent at every stage. So I know one thing I've incorporated into my postpartum doula work is maybe I'll add like a couple of visits to the house so you can just sleep or just,
Oh,
whatever you might want to do at that moment.
I
Cause
wasn't that around when I had my babies. I love that.
yeah, just a little bit of, sometimes people just need space. It's a lot. It's a
It
lot. So
really is.
sometimes you might just need space or time alone, like take a nap, whatever. So that's what I'll do in my role. In terms of breastfeeding as well, I'm happy to see things like lactation breast consultants be like more of a popular thing nowadays. So it can also look like helping you solidify care in that way. There's also a lot of community-based programs that offer that now too.
Yes.
So, yeah, depends on that specific person's goals and needs. But, it can look like a little bit of care coordination depending on that individual.
Right. So it could be a doula or a lactation consultant for the breastfeeding piece, or
Mhm,
maybe
but
both.
yeah, maybe both at that moment. I personally do not have like the lactation breast consultant certificate. So that's
Okay.
something I'm still learning myself, but it can look like, to help you solidify somebody in that moment. I will say being a doula from DMV, there's like a strong network. So it can look like hopping in the group chat or like, the
Mm-hmm.
hospitals are offering at home visits now too, which I'm happy to
Sure.
know about that. So helping you do that or just being there once again while you talk to whoever and I have a baby, whatever it looks like at that moment.
Mm-hmm. Mm-hmm. Beautiful, beautiful. I read an article yesterday about having the postpartum follow up either in the hospital or immediately afterwards, particularly for women that have traumatic labors.
Mhm.
And it was just so interesting how the rates of depression were going down when they offered that additional support. So
Okay,
thank you for that comment.
thank you.
Dr. Leak, anything else that we need to discuss that you would like
Um,
to leave with the audience?
yeah, no, I think all patients, no matter who, what, where, or why, need an advocate. It's overwhelming. And oftentimes the language, the words, the conversation, the next steps can't be remembered or not
Sure.
clearly understood, or you haven't had a chance to make sure your voice was heard. And that's where advocacy comes in. And especially with pregnancy, even though we might have done it 3 or 4 times before, each
Yeah.
pregnancy is different. And I
Yeah,
think
that's a good
it's
point.
so important that there is an advocate who, number one, can help you remember things, because we know pregnancy fog and all of that. So one who can help you remember things, can advocate for you, and also can be a voice for you. And that at all times should be considered beneficial to your physician or your midwife. Because again, the role of a doula is to be the patient's voice and advocate for the patient. And that is our job, is to be there for the patient and to hear the concerns, the worries, the needs of our patients. And if there is someone there to promote that, to help that, to support that, how could we not support them? So that's my take on doulas.
Excellent. Well, I hope that this work is not only happening in Maryland, that it's happening all throughout our viewing audience. And so thank you, ladies. We may circle back as we come up with more questions for you, but this was an excellent discussion and we really appreciate your time.
Thank you for the opportunity.
Yes, thank you.